Good morning to everybody. I'm Dr. Roberta Maselli from Humanitas Research Hospital and Humanitas University. And today I would like to share with you the results of our paper, Endoscopic Suturing for Gastrointestinal Application, Initial Results from a Prospective Multicenter European Registry. I'm the first and co-author, and I'm really glad to share with you the results. This is a multicenter study from 9 different European studies. And as a background, we started from the point that we know that flexible endoscopic and luminal suturing has been used nowadays as an alternative to surgical treatment for a really wide spectrum of clinical condition. And the suturing system was used in clinical practice. There are mainly two: the overstitch devices, that they are the overstitch, the standard one, but also the SX version, the overstitch SX. That is this one compatible with a 2.8 working channel. So it's compatible with a wide range of endoscopies that can be produced by different manufacturers. The fact is that the experience reported with the new overstitch SX is still limited, with only case reports or small series has been published so far. And this is why we aim to collect prospectively data from different European centers to create a dedicated European registry and to prospectively collect both technical and clinical data regarding both systems, specifically for GI application. So our aim was to provide procedural outcomes and also to find correlation between procedural characteristics and outcomes. So in this paper, we show the initial results for the first 3 years of this registry. And this is the first prospective registry aiming to collect the data for both systems. So we collected all patients who underwent endoscopic suturing from 2008 to 2001. So it's the first 3 years at 9 different European centers. And we focus on different variables, the type of disease treated, suturing patterns, but also the course outcomes. And mainly, we classify the type of procedures into 4 main groups. That is basically closure of mucosal defect. That means also full thickness, but intentional defect, for example, after ESD, EMR, POEM, or after full thickness. And closure of full thickness, but for those defects that was not intentional. And in this group, we have, for example, fistula closure, perforation, postoperative leaks or anastomosis dehiscence, but also the management of post-surgical complication. Then we have a group apart that is the stent fixation, and another group that is the all other procedure that they are not comprised in the other 3 groups. Regarding the outcomes, we explore 3 different outcomes. That is basically the technical feasibility, defined as the success to introduce the device and reach the target treatment size and area. And this is because the overstitch is an over-the-scope device, and theoretically, it could be difficult to reach some areas of the gut. And this is why we explore also this type of outcomes. Then, of course, we have other 2 outcomes. That is both technical and clinical success. The technical success is defined as the successful suture placement in the target area with the desired orientation determined endoscopically at the end of the procedure, but also the clinical success that finally is the complete resolution of the clinical issue for which we underwent the endoscopic suturing for that patient. For sure, also safety was investigated by collecting all those adverse events related to the procedure or to the device. And then we've done a robust statistical analysis, mainly for the correlation analysis that is called the Pearson coefficients, that aimed us to try to identify possible success potential predictive factors. We consider for this type of analysis the procedure year. I said at the beginning that we consider 3 different years, but also the gender of the patient, age, defect size, because also the success of our closure could depend also by the size of the defect that we are trying to close, but also the location, the type of technique we use, meaning interrupted or continuous suture, and also finally the number of suture applied. In the first 3 years, we were able to collect a lot of patients because we collected 137 patients, and I'm very glad that the technical feasibility was 100%. I mean that we were able to reach the target area in all the cases, regardless the type of devices we were using, standard overstitch or overstitch SX. And then if we go overall to the technical success, we were able to arrive to our goal in all patients but one that was a really chronic rectum urinary fistula. Chronic, it means more than 30 days. There was a large one, more than 1 centimeter, and in only that one case the suture was technically not feasible and not possible to achieve. We recorded no adverse events, so from the safety point of view this is a very good procedure, and the clinical success overall, let me say that is very high because reached 89% with a good follow-up data that was reported in more than 100 patients, that is the more than 73%. Depending on the type of treatment of disease that we were trying to treat, we have different success. So the highest one was the mucosal defect that was 100%, and the lowest one was lichen fistula that was almost 65%. Instant fixation was very good, was 85%, and perforation reached a clinical success of almost 95%. The correlation analysis then that we have done showed that was no significant correlation between location, suture pattern, or number, and the success we found. The only exception was the fistula. In the fistula group, we found that fistulas less than 1 centimeter that were treated with continuous suture were more likely to achieve clinical success in the follow-up. This was statistically significant, but of course we need more data and further perspective with a larger series data to underline this point. But this is a great point that we achieve. So in making all conclusion together, we can say that the overstitch and the endoscopic suturing has a high technical performance with an excellent safety profile, and also an excellent overall technical success of more than 99%, with a clinical outcome success of 89%. So we are demonstrating with this paper that the overstitch technologies provides a reliable suturing with clinical advantages, especially for fistula less than 1 centimeter. Of course, specifically this point need to be addressed in the future with, as I was saying, a larger series, but at the same time, this is a great point to highlight and to underline. And in particular, this study is important about the overstitch SX because it's the newest one, and we use it in all the patients we treated and we collect in this study in almost 20% of patients of endoscopic procedure. And this is the newest one because it was introduced in the market in April 2019. The registry started in January 2018, so it was very new on the market. And we have to remember that unfortunately, we are having in that time the COVID-19 pandemic outbreak in 2021, so we were able not to collect so many cases together. So this is why these results are still limited, but very important from this point of view. So in conclusion, with our study, we demonstrate that both systems, the overstitch systems, are technically feasible, and regardless the site of use and the type of treatment, we have no failure in managing the device. And with the technical success that was so high, more than 99%, and the clinical success of 89%, we can really say that they are a promising incentive for continuous collecting data in this registry to have more data and to treat as much as we can in the best way possible our patient. Thank you for your attention.